everyone. Welcome to Let's Talk About It. So glad to see you again today, and wherever you might be watching this broadcast, I welcome you once again to Let's Talk About It. Got some great things that we want to talk to you about today, but I want to say hello to Lake Providence, to Tallulah, Rayville, Farmerville. Some people were watching me all the way down in Farmerville. I thank you for watching this broadcast, and I thank you for it. When you see me out in the shopping center and in the store and marketplace, that you always stop and tell us that you enjoy the program right here on KMCT. So just keep watching us, because we're going to keep bringing you some great things that I believe that's going to have information that will help you. Well, today I've got a great guest. Let me tell you something. I want you to meet Dr. Elroy. She is a licensed consultant pharmacist, and I welcome you to Let's Talk About It.
Thank you so much for having me. I'm so excited to be here.
All right. Well, like I said, we're going to talk about some great things here today. So let me formally introduce her to you. I know many of you that's out there in the community watching, I know you know her, but I want to introduce her to you and tell you some things, and then she's going to talk to you about some things that she's doing and what God has given her and how this is going to help you in different areas of your life. Dr. McElroy is a licensed pharmacist for over 2 decades, and she has launched the Medication Management Consulting. We need that because so many people mismanage their medication.
That's correct.
And in effort to help improve the health of our community through face-to-face interaction, she works to provide education on medication safety and empower patients to take an active role in their health care. The mission of MMC is to reduce medication-related problems and to ultimately have a healthy, positive impact on patient outcomes. So I'm going to once again yield and allow you to tell us all about this and what God has given you to do, what you're studying and doing, and how it's going to help our patients, and overall how it's going to help us when it comes to overdosing. And, you know, we have a crisis going on right now with opioids and things like that.
Yes.
So just go on and talk and tell us about it.
First of all, thank you so much for having me. It's an honor to be here with you guys as well. I just thank you for the platform. I'm really excited about this new business that I'm launching, Medication Management Consulting, and it's strictly an educational-based service for the community. Over the years, Pastor Hunt, I've gotten so many questions regarding medications throughout the years. You know, people have questions. They don't fully understand why they're on different medications or how to appropriately take those medications. And so it's really just to get knowledge and understanding to the people. And the overall goal is to empower you to take an active role in your own health care and to improve health outcomes.
So. You know, because sometimes we go to the doctor and we get our prescription,
yes,
and we go and we get our medication, and we don't ask the right questions.
Right.
So we don't understand everything,
right,
especially the elderly patients.
Yes, they don't always know the questions to ask.
Yes.
You know,
yes.
And sometimes as medical professionals, you use terminology that people do not understand. And so they leaving with this medication and they really don't know exactly what's going on with it.
Yes, and sometimes, you know, overtake it. Take it, you
yes,
know, and for me, I take it long enough till I feel better, and then I stop taking it.
Right.
So all of those things. But I was looking here at some of the areas of focus, and I know that one of them is managing your meds. Tell us about that.
Yes. Okay. So I really have 3 basic services. One is to do medication management, medication safety clinics, and that's going to help you to understand how to better manage those medications. So it's available for schools. It's available. It'll be great to partner with the city and hold meetings in community centers, recreational centers, your libraries, so we can just get in an intimate setting and just really break down and talk about different medication topics.
And a lot of also in a lot of the outpatient clinics.
Yes.
Especially for mental illness.
Yes.
You know, if you could get it in there, that would be great, because so many of them
right.
may have been dealing with some kind of addiction, but
right.
now they have a physical problem, and they've been
Yes.
given medication, and they're, you know, and I can see how that can really be battling with each other.
Yes, you're
You know,
trying to balance it out.
yes,
Right.
yes. So that would be a great idea. So if you're watching, you know, and you're
Yes.
working in a clinic where it's mental illness taking place, addiction, disorders,
Yes.
then that would be a great place to really
Right. I'm
go
so
in
glad
and do
you said that.
workshops and sessions and things of
Yes.
that nature to help them to understand what they are battling with.
Yes, I'm glad you said that, because one of the other services is one-on-one consultation, and it's available for physicians' offices, those clinics just like you just mentioned.
Yes.
And once you see the doctor, you see the nurse, that's for physicians who will want to incorporate a pharmacist within the team. It's an interdisciplinary approach. We're all working together to help improve your health. So once you see the doctor, you talk to the nurse, then you can come see the pharmacist, and we'll do a complete medication review to help you really understand why you were prescribed what you were just prescribed, and how to better manage those medications.
You know, this is so needed because, once again, I'm going to put myself in the position of a patient.
Right.
I just left the doctor. I have my medication. He's giving me my prescription. I go to the pharmacist, to the drugstore to pick up my prescription. All I know is that I'm just going to get what the pharmacist give me. I never stop to ask any questions.
Right.
And I understand that they're, you know, busy, and the pharmacists are busy, and you all are doing, you know, what you're
Yes.
instructed to do. But it would be so nice if I could get some extra information to
Exactly.
explain to me some things about the medication.
And that's why I'm here.
That absolutely. You know, one day I received some medication. I went to the pharmacy and I got my medication.
Yes.
And when I made it home, they sent me some information in the mail about the medication. Do you know it frightened me?
Yes.
It frightened me, and I said, I'm not taking this. I put
Right.
it aside, you know?
Right.
And then I had to go back to my doctor and say, look, I got this pamphlet in the mail about my medication, and I'm not going to take it. And he had to tell me, once again, all about the side effects and different things like that.
Right.
But it would have been so much better for me. I mean,
Right.
it really eased my mind if I had been able to talk
Right.
to someone like you that does this, that could explain it all to me, because
Right.
then I would have had better results.
Better results, and you wouldn't just not take the medication, and then you're not feeling well. You know, you're needed for
Absolutely.
some particular purpose. You know what I'm
Yes,
saying? But let me
yes.
tell you something about side effects.
Okay.
You know, you see the list of side effects in those medication pamphlets and stuff. If it happens once, they have to report it. So a lot of times those side effects are not common at all. It's like a small percentage chance.
Ooh, that
So
helps.
if it happens, they have to report it. They have to include it within that information. So that's why you really need to arm yourself with the knowledge, you know, so you really can get a better understanding. What are the most common side effects that this medication may pose? Or what should I look out for if I take this medication?
Yes, and I'm sure that the doctor prescribed it for you.
Yes.
You know, then it's something that you need to take. And so
Yes.
don't do like I did. I just put the medicine aside. I said, ooh,
Right.
I'm not taking this, because it really frightened me.
Yes.
And I'm sure it probably frightens some others, that when you see all the side effects, you say, oh no, I'm not going to take that.
It's very
But I'm
frightening.
glad that you're saying that it's a 1%.
A very,
Very
small,
small
percentage. It can be
percent.
less than 1%. But if it happens during the trials, before the medication is approved, if it happens, it has to be reported as a side effect of that medication.
Oh, knowledge is power.
Yeah.
So this is
Exactly.
great. We need that knowledge, and
Yes.
especially for the elderly.
Oh,
I'm
my
always
goodness.
concerned about the elderly, especially with the opioid crisis.
Yes.
And especially with them overtaking their medication or forgetting that they have taken the medication. And I'm
Yes.
sure there are some things that you could tell them to show them how the best procedure that they could use in taking their medication to make sure that they don't overtake
Right.
it.
And to help caregivers that take care of the elderly as well. You know, we can have some strategies on how to better manage those medications. Yeah, with the elderly, as you age and you get older, things tend to slow down, right? So
Yes, it does.
you don't need as high of doses. And some of these elderly patients, they may be on 10 and 20 medications, and that's not an exaggeration. So with all those medications come a lot of side effects. And so it's like you're treating the problem, but then you're creating a problem. And so that's why we really need to look at the medication regimen and see what is needed, what can be, maybe a dose can be reduced, or maybe
Yes.
a medication can be removed altogether.
Or there could be a different kind of medication.
Yes.
Because I've gone to the pharmacist before, and said, "Is this the best one?" And so, "Oh, we can give you this one."
Right.
And so that I have experienced.
Right.
And I think elderly needs to know that.
They need
because
to
there have
know.
been so many, so many elderly that walk up to me, even there in the church, and say, "Pastor, they've given me this kind of medication. What do you think?" And I'm thinking, I'm not a pharmacist, I'm not a doctor,
Right.
but I don't understand. So once again,
Yes.
that is so needed that they will understand why you're taking it, what time you need to take it, and help them with,
Right.
the process.
So it's great for the city to contract the service, and we can set up meetings in different communities. We can do small settings. You can come. We can give you the information. It can be on various topics. You can send me a note on MediManage.org, that's the website, of different topics or questions that you may have, and we can address those questions.
Yes, we're going to come back and give you that address again, because we want to make sure that you do not miss that address, because she's filled with knowledge and she'll be happy to share that information with you, and to come to the schools or your church or a community setting, any kind of clinic, the mental illness clinics and things of that nature, to set up and explain this, especially to them, because my heart goes to those that are mentally ill. And I know that so many of them do not have the information that they need when it comes to medication and addiction, and how those medicines are mixing together, because now you have a physical illness along with the mental illness, and now you have a bottle of medicine sitting there, and you really don't know one is affecting the other. And so that is really something that I think many of the clinics are dealing with. And once again, I keep mentioning that opioid crisis, because I've spoken about it so many times, because we have so many people that are experiencing that because of the overdose of medication. Many times it's the overdose of medication, or it's using the medication, for other purposes, where you have a headache and you say, "Oh, I'll just go and get this." And you go back to your medicine cabinet and you get something that you was prescribed last year, and now you're having a total different symptoms and effects, but you really got something you was prescribed last year. So once again, that's something that I think the community needs to address.
The CDC reports that 192 people die from overdose of those opioids every day. So it's a serious problem that really needs to be addressed. I tell people, if you don't need it, don't take it. Because addiction with those opioids can happen really quickly in a short period of time, 5 days or more. So if you don't need it, don't take it. That's what I say. You want to try other means of pain control, like relaxation techniques, acupuncture. It's all kind of things that you can take, are non-pharmacological type things. You want to try to investigate that, and those are things that we can talk about in the workshop to really help sway people from those opioids. It's really for those who have those chronic pain, and cancer patients usually take it and things like that. So if you don't need it, try to stay away from the opioids.
All right. What about child safety? I see that's another area of focus.
That is something I'm really, really excited about. So we have a clinic called It's Not Candy. And so I got it from, actually, when I was in school working on my doctorate. It was a presentation that I presented at elementary school, Prevailing Faith Christian Academy. And so it's a fun workshop, a fun clinic, and I'm excited to present it to different schools, the community. We're going to have a lot of fun with it, and it's really teaching children about medication safety. So we'll have displays of candy that looks a whole lot like candy. Medications look like candy, and so you have kids that are really curious. And then we're going to talk about, like, when you have people that come to your house, they may be taking medication. You want to make sure your guests put those medications away, store them away, because kids, they said 60,000 kids a year come to the emergency room department because of accidental overdoses from these medications. So we're going to make it really fun. We're going to incorporate music. My son is a recording artist. And so he's writing music especially for...
We're still waiting on him to come to the church.
It's Not Candy Clinic. So we're going to have a lot of fun. We did it at Prevailing Faith. And the kids, we incorporated the music. I wrote a little rap song. I don't rap, but
you wrote the song.
But it's a little tune that they can repeat and remember, and it gets inside of them. The more they say it, it gets inside of them, and they'll remember medication is not candy.
And you know what? I'd love to have you in the schools.
I would
Because
love
we're in the
it.
schools teaching life skills.
Yes.
And kids don't gamble, those two things. But in the
Right.
life skills, we talk about addictions and drugs and
Oh,
things
that's
of
great.
that nature. And so this would be great for
Yes.
you to be in the schools teaching the children, especially once again with addictions and with
Mm-hmm.
overdose, for you to be in the schools teaching the children right there that it's not candy.
It's not candy.
And the harmful effects of it.
Yes.
And how many children, you know, probably overdose or even demise from it. You
Yes.
know, so we want to be able to get in there and talk to the students in the schools. So I'm going to look into that. Because,
That'd be great.
Because like I said, we do the life skills program. We want to do everything we can do
Yes.
to help our children. I have 6 grandchildren, so you know,
Yes.
I'm always on what can we do to help the children and
Mm-hmm.
to talk to the children in the schools about this safety. It is
We
not
have to
candy.
do
Oh,
it.
we have to do that.
We have
do.
to start early
Yes.
because kids, even in middle school, kids are smoking, they're vaping, they're taking drugs
they
and
are.
marijuana. You know,
Yes,
we
they
really, really have to help our children.
Yeah, and they don't understand the effect of it.
They
think
don't.
it's just something, you know,
Right.
fun, something that peer pressure. Because we talk
Yes.
about peer pressure. Your friends are doing it, so the other children decides, okay, well, I'll do it. You know, they'll pass you a pill or something.
Exactly.
And you take it thinking, oh, it's not going to hurt you or anything. What may not hurt one child can hurt another because of the I guess, the buildup of the body or
Yes.
the whatever's inside the body system. I'm
You're
not a
right. They
doctor
don't
or
think
anything.
about
I don't
the
know all of that.
long-term side effects.
Absolutely.
Yeah.
And immediately you can take something that all of a sudden now you've lost your mind.
Yes.
You know, the effect of it.
And
so,
they're dropping out of school.
yes, so many of them are dropping
So.
out of school, even at age 9, 10, talking about, I'm not going back to school. So
Yes.
we deal with some of those things and then get to school and cannot study or learn. They become, you know, I'm not going to call them problem children because they're not. They're just experiencing something
Yes.
that we sometimes that even the teachers don't understand.
That's right.
And so they've
That's
taken
right.
some kind of medication or something like that, and there we have that problem. So I think that is awesome. We're going to look at getting that into the schools, child safety. It's not candy. So parents, you may want to write this information down as well. Like I said, we're going to come back and give you all this information before we go off today so that you will be able to make the call to her,
Yes.
especially if you have a child that's experiencing any of this or right there in the school, and we want to make sure that you know much about it as you possibly can.
Yes.
Okay, I see something, another African Americans and hypertension.
That is huge. It's something very personal to me because in my late 30s, I was diagnosed with hypertension.
Okay.
It seemed to come out of nowhere. I went to the doctor regularly, and every month it was fine. Every year it was fine. And then one year, boom, my pressure was just all out of balance. And so I really like to focus on hypertension with the African Americans because our diet affects it. And then research shows that there is a gene within us that may be make us more sensitive to salt. And you know our diet is full of sodium.
Yes.
So that's an area I really like to focus on. And the American Heart Association has a great website, great information, and they have information for African Americans. So I would encourage you to go and check out the American Heart Association. So.
Yes, because the first thing we do, we get our food, we reach for the salt.
Yes.
And we start checking and we don't think about it.
Right.
We don't think about how much salt am I putting in my food or how much salt has already been put into the food. And as you said, salt is one of the things, you know, that we've been trying to
Yes.
cut back. And the
Right.
same thing that happened with my husband. Going along fine for years, no
Yes.
problem. All of a sudden, whoop, in other words, there it is, high blood pressure.
Exactly.
You know, and so we're having to, have to deal with it.
Have to deal
and
with it.
but we need to educate the community.
Yes.
Because I believe they don't get enough information on hypertension
Yes.
to begin to make good decisions, because doctor visits are short, because there are patients to see, and we understand that. Doctor visits are short. So we're saying they need to get more information.
More information.
Many times they'll get a pamphlet, take it home, put it aside,
Yes.
never read it, but we want to be sure that they get the right information,
Right.
that if they've been diagnosed with hypertension,
Yes.
how to manage it.
How to manage those
Yes.
medications, because sometimes they'll start feeling better, or it makes me feel tired, and then they just want to stop taking the medication.
Yes.
And that's very dangerous. We're seeing people, I work in a hospital, so we see young people having heart attacks and strokes. I mean, like in their 30s, really
Yes.
young. So we really need to get that information out.
Yeah. And the information is right there on the screen. We're going to give you time. They're going to put it back up for you again. Go on and write that down, get that information where you can contact her, especially if you want her to come and speak to a group, if you want her to come and present all the information that she has there for you. She'll come to your church. She'll come to your backyard picnic.
That's right.
She'll come to wherever you are. She will come and share this information with you so that you will be empowered to not overdose in medication, have the knowledge about your medication that you're taking and everything that's concerning it.
That's great.
Also here I see, I'm looking at all the different focuses here that she has on her website. And of course we've spoken about mental health, but I want to just mention that again, mental health, because that is really something that we've been looking at for quite some time, and that is affecting many people that they think, you know, maybe something else is wrong with them, but really they have a mental illness.
Mental illness,
and it does not discriminate.
That's correct.
You know, mental
That's
illnesses does not discriminate. I want you to know that professionals, children, people that are educated, all races, it just does not discriminate.
Right.
So just share a little bit of information about how you present that.
Right. So this is, we're going to talk about, especially with the children dealing with mental health issues or attention deficit. That's a big one. So we'll present on how to better manage those medications, how the parents can help the teachers, because some of the parents don't like to give the children their medication or like to hold on to it. So parents, we really stress, please help the teachers out, because when you help the teachers out, everybody in the environment can learn, the other students as well. So we're going to really talk about things like that attention deficit and how to manage those medications, how to help your child, and we'll give you other resources to help, you know, talk about that topic.
Absolutely, absolutely. I know you're listening to us, and once again, this is Dr. McElroy, and she is a licensed consultant pharmacist, and she has a wealth of knowledge on this topic, on these different topics. The focus here about helping you to, when it comes to child safety, this is not candy.
Yes.
Patient empowerment, managing your meds, especially for the elderly, and even those that are really, really sick in the hospital, those that may be even at home very sick, and helping the caretaker to know how to administer that medication to where they are not overdosing or not giving the medicine.
Not giving the medicine,
trying to go both ways here. Or not giving the
Exactly.
medicine. And don't be like me. I said earlier, I stopped taking my medication because I didn't have the knowledge. I didn't have the wisdom.
Right.
So I just said, oh, no, I'm not taking this.
Especially with antibiotics. You
Yes.
just don't, if a doctor prescribes you antibiotics and you have an infection, you want to take the full course of those antibiotics unless it's really just making you seriously ill. Because over time, the bugs are very wise and sharp, and we see that with the coronavirus, how it spreads, you know, so that the bugs are really smart, and so they find ways to get around the antibiotics, and then your antibiotics no longer work. So if you're given an antibiotic, make sure you complete the therapy.
I thank you for that because I'm guilty of that. I really am. You know, if my doctor prescribes something, I take it until I feel better. And I know some of you do the same thing, but you just heard the doctor here. Do not do that. You need to take all the medication. That's why they prescribed it for you. And as you say, we may think just because we got a day where, I'm feeling better, I'm good, I can get up. It does not mean that it's totally gone.
Yes, you need to kill it completely.
And what happens, I had this to happen. Get up a week or two, I'm feeling great. The next week, I'm back with the same thing again. Why? I did not complete my medication. So don't you do that. Listen to the doctor. Listen to Dr. McElroy here as she tell you to complete the medication, okay? That's a big one, okay, all right? So once again, that's an area of focus of helping you to manage your medicine, and then if it's not making you feel well, and you need to,
That's
know,
when you
talk
need to
about
talk to your doctor.
Yes, go back and talk to your doctor if you're having some side effects from it. To go back and talk to your doctor and not be afraid to talk to them. So many patients are afraid to ask questions. And if you don't, if you're afraid to ask questions, you can contact her. Like I said, she will come, she will work with you, and she will help you to understand what's going on with the medication. She's she's educated and trained in this area, okay? This just this last one we're going to talk about before we go off, because this is a big one, and we've said some things about it, but that opioid epidemic, and that's the managing the medication. What are some more things you can share with us about that?
Right. Well, you know, the state has a lot of great programs. If you were visit Louisiana, I think it's louisiana.gov, I can't remember exactly, but they have a lot of programs to help if you're suffering from addiction, or if you think you have a problem, you know someone that has a problem. Contact somebody, you know, let us know, and we'll get you the right resources and get you the help, because those opioids is very serious. We're making strides in decreasing the overdoses because of they've tightened the laws, and the doctors are changing their prescribing habits. But it's still a serious issue, and people are still overdosing, and now we have the naloxone, which is a reversal agent. So there are things that are available to help us, but we want to try to find other ways, other medications that are non-opioids that can maybe help manage your pain.
All right. I told you we were going to talk about some good stuff today, and this is some good stuff today. So, Dr. McElroy, is there anything else you want to share with them about your business? We got like a minute before we go off the air, and share with them, and then once again, we'll put it on the screen how they can contact you.
Okay, I'm so thankful to be here. The overall goal of Medication Management Consultant is to help improve health outcomes, to decrease those medication-related problems, and we just want to educate. You know, knowledge is power, as Pastor Hunt said. And so get that knowledge. Contact us. It's a great service. I want to partner with the health units, physicians' offices. Just get out there to help create a healthy community.
All right, and you know you want to be healthy.
Yes.
Because without health, it just stops everything that's going on. So we want you to be healthy, and I am so thankful to you.
Thank you.
I'm going to have you come back again and share some more information. I got a lot of great ideas. Just sitting here talking to you about what's going to help the community and help our children in the schools. So Dr. McElroy, thank you so much. Tell your husband hello for me.
I will.
Eric McElroy, hello. He's a great friend of mine, and I just love you all. Bishop and I love you all.
Thank you so much.
And so it's just such a pleasure, such a privilege to sit here and talk to you and share this information, because I know that it's going to help many people. And what you have here, so many need this service. So I am glad that you are watching, and if you know someone, pick the phone up and call them and say, you know, I listened today to someone that can help me, that can help others. Once again, in the clinics, in the hospital, in the different groups, in the schools, here is the information right here that can help to solve these problems that we're having. So I thank you for watching. God bless you, and we'll see you the next time right here on Let's Talk About It.
Yes.